Hello and welcome to this genetic informative pill from Genyca. Today we are going to talk about cardiovascular risk, its genetic basis, and how to prevent it. We are going to talk about predictive genetics, the genetics of cardiovascular diseases, and finally about how to perform a genetic study for this disease. Predictive genetics is a medicine branch allowing determination of the probability to develop certain diseases during adulthood and providing adequate preventive measures with the objective to avoid the disease. When the disease cannot be avoided, at least we are going to try to delay its onset or diminish the symptoms. Every method of predicting future diseases is based on genetics, genomics, and DNA studies. The more we know about the information contained in the genetic background of the patient, the better we can adapt the environment and then prevent the disease. So this came about know, change, prevent is the basis of predictive medicine. On the left, we see that there are genetic diseases in which a single mutation in a single gene is responsible of a single disease. These are genetic diseases, monogenic diseases. But the most common diseases are on the other end, in which the genetic component is polygenic. There are many genes involved, and each of them has a different change or mutation, and it is the addition of the effect of various genes what causes the disease. These diseases are multifactorial, and environment also affects the pathology. The most frequent within the general population are presented here, and among them we find obesity, cardiovascular diseases, diabetes, cancer, celiac disease, osteoporosis, Alzheimer. Multifactorial heredity is like playing Russian roulette. The black numbers are the genetic factors, and the red numbers the environmental factors. The more we bet, the more numbers we bet, the more chances we have to develop the disease. Let's talk about cardiovascular risk. Cardiovascular diseases are a group of heart and blood vessels disorders, including hypertension, venous thromboembolism, dyslipidemia, and ischemia. They affect many middle-aged people and are the leading cause of death in the world. According to the WHO, the World Health Organization, 31% of registered deaths worldwide are due to cardiovascular diseases. Most of strokes are ischemic attacks. These occur due to the gradual formation of atherosclerotic plaques or fatty deposits in the interior of arteries that nourish the brain, or they also occur when a blood clot blocks a cerebral artery. Like all multifactorial diseases, the development of coronary atherosclerosis has the influence of genetic and environmental factors. Within the environmental causes, we're going to find alcoholism and drugs, or the presence of a previous pathology, such as diabetes mellitus type 2, gut, renal failure, hypothyroidism, metabolic syndrome. But there may also be genetic causes, monogenic, such as familial hypercholesterolemia, LDL receptors deficiency, and multifactorial causes, in which there are genes involved in plasmatic transport of lipids. These are the apolipoproteins, and they are the responsible of these diseases. It is important to understand that at least 80% of premature deaths from heart disease could be avoided thanks to predictive genetic studies. Now we are going to explain how to make this genetic test. We use oral mucosal cells, saliva samples. We open the package of the swab break in the security seal and remove the swab without touching the cotton swab. Then we insert the cotton swab inside the patient's mouth and we rub up and down on the interior of the cheek area for at least 1 minute, pressing firmly. We're going to take 2 swabs from each patient, 1 on each cheek. Once we have done the sampling, we place back in the protective tube and we identify the patient's full name and seal with adhesive tape or similar. The only precaution is to have a clean mouth. 1 hour before, the patient must avoid eating, drinking, smoking. This is general protocol. Patient will visit his specialist doctor in a first consultation. They're going to do the sampling then and fill in the request for a genetic test form. Then the specialist is going to send the samples with a document to the laboratory. And the laboratory will send back by email with protected password the results. In a second consultation, the specialist will show the results and explain to his patient and give the recommendations. Undergoing a cardiovascular risk genetic test with Genyca is easy. We use a saliva sample, painless and non-invasive. Convenient, the sampling can be done at the consultation. Unique, genetic results are valid for life. Innovative, this is a new tool for the specialist at the forefront of technology. Familial, results allow preventing cardiovascular diseases in relatives. And effective, the specialist is going to be able to apply a personalized treatment based on the genetic results. So, know the patient's DNA today to help them prevent future diseases. Thank you very much for your attention. If you have any question or comment about this test or any other genetic test, please write to the emails you see in the slide. Thank you very much.